Good day, ladies and gentlemen. Our program will begin in just a moment.
After dinner with Sean.
Good day, ladies and gentlemen. Our program will begin in just a moment. Good day. Welcome to Advocacy Anywhere, powered by AJC. Advocacy Anywhere is AJC's digital platform that enables you to engage with AJC's global expertise, content, and advocacy from wherever you are. Today's program is brought to you in partnership with Jewish Insider. You can sign up for Jewish Insider's daily kickoff by visiting www.jewishinsider.com. Mayors across the country and around the world are on the front lines of the COVID-19 response, making critical decisions every day about how to protect their communities while also working to restart their city's economic engines. We are pleased to be joined today by Mayor Eric Garcetti of Los Angeles, California, and Mayor Betsy Price of Fort Worth, Texas, who have both recently traveled to Israel with AJC Project Interchange to discuss the impact of the coronavirus crisis on their cities, the integral relationship between cities and the federal government, the role of political leadership in a time of crisis, and the lessons they've learned about community resilience. Mayor Garcetti and Mayor Price will be in conversation with Melanie Marampel, AJC Managing Director of Regional Offices. After we hear from Melanie and our esteemed guest, we will take your questions. You may email your question to questions@ajc.org, that's questions plural, or use the Q&A chat feature in Zoom. Melanie, you have the floor.
Thank you, Daniel, and thank you so much to both Mayor Price and Mayor Garcetti for joining us today. It's so nice to see you both here and looking well. I first of all, just really grateful that you're giving us some of your time today. We know how incredibly busy both of you are and what the life of a mayor must be like. We can only imagine right now. So if you can, let's begin by just sharing a little bit about how the COVID-19 crisis has impacted your cities. And Betsy, why don't you kick us off?
Sure. Thank you for having us. It's great to see everybody. And my dear friend, Rabbi Bloom from our temple here is on. He told me he would be on today, and he texted me, Melanie, it's great to see you after traveling with y'all. We had a great time, and I'd go back in a heartbeat. Learned an incredible amount. And Mayor Garcetti, it's always fun to be on panels with you. He and I have done a lot of panels. Fort Worth has dealt with this. We've been fortunate for a city our size. We're about 900,000 people, a very young city. Our average age is 31, and yet we have a big population of retired folks also, and very diverse demographics. We're 35% white, 36% Latino, and about 19% African American. But we've been very lucky. Our numbers have not been near as high as some of the other Texas cities. We're a very spread out city, not a lot of public transportation. And when you're recruiting businesses, sometimes they want that density. Well, in this case, the lack of density has really helped us. We've got about 2,700 confirmed cases, and as of yesterday, about 88 deaths in the city. The economic impact, I'm sure we're going to get into that later, but the economic impact on the city, the loss of sales tax, probably the downgrading of some of our property tax is going to hit the city's budget. We're about a $1.4 billion budget, and we estimate this year alone will be about 70 million or more. We've managed our budget very well. We're very conservative, fiscally responsible. So we're going to get through this, but long term, this is a 3 to 5 year hit for cities on their budget, particularly on tourism side and for small businesses.
Thank you. And Mayor Garcetti.
Well, good to see you, Melanie, and Mayor Price. Always great to see you as well. It's awesome to be with AJC, and all of you, thank you for making the time too. You know, I represent this small little city called Los Angeles, and it is one of the most diverse collections of human beings arguably ever put together in the history of the world. It's a global crossroads. It's a place in which we have folks who literally originate from every country in the world, speak every language. We're proud of that diversity and that sense of belonging that we all have. But it's also one in which we pulled from that value to come together in a tough, tough time. Very proud Los Angeles for a dense urban setting, and the metropolitan area of Los Angeles is the densest in the United States. It's denser than the New York metro area. but we've seen probably about a 20th impact of what we saw in New York City. We went very early into taking strong actions. But that said, we've still had for a state, we're about 25% of California's population, about 50% of our cases are in Los Angeles. So we have a high number of cases relative to the middle of the pack of America, but we've done extensive testing. So we're a little under 50,000 cases, about 2,000 deaths. But we're the first big city in America to offer universal testing with or without symptoms in 38 testing centers. We just opened up the largest testing center in America yesterday at Dodger Stadium, which can do 6,000 tests a day. And we're very proud. I think Mayor Price would agree. Mayors have suddenly had to become health experts, and usually it's the state or the county that's in charge of that. Counties often have executives, but sometimes don't. So they're set up to do extraordinary work, but not necessarily always to make quick decisions or to stand up in crises. So we've had a state of emergency here, certainly use those powers to be able to stand up testing, help expand capacities in our hospitals, but all of our numbers have stabilized, so that yesterday we announced that we would reopen all of our retail. Probably by this weekend we'll get to things like restaurants, but it makes me quite nervous because now we have the choice of whether to go to these places. A lot of people will stay away. We've got very vulnerable populations, and this nation needs to continue to protect, especially our seniors and people who are in congregate living settings and those who have pre-existing conditions, where 92% of our deaths have occurred here in Los Angeles among those groups. And also for the employees in a lot of these places who can't make a decision. And I hope that we can kind of cut through what was really nonpartisan. I mean, I looked at the Republican governor of Ohio and the great work that he did. I looked at the Democratic governor of Colorado and how he safely led reopening. It's really not as much as maybe cable news wants to paint this a red or blue issue. We have to do sensible reopenings because people are suffering. And certainly I'd echo what Mayor Price said. We're seeing a devastating impact on states and cities and our budgets. We're also very fiscally conservative. We haven't had bond downgrading in this. We have the largest reserve fund in our history. That said, we're facing huge cuts just to our basic services. So I hope that Washington can continue to look at our local and state governments as key parts of our economy and helping stand up the fight to defeat the pandemic.
I'd like to stick on that for a moment and focus on Washington for a moment. The House recently passed the HEROES Act, which included an allocation of $187.5 billion for local governments, and yet Speaker McConnell has indicated some skepticism about funding states and local governments. And I'm interested to hear what this assistance would mean to you and your cities, and what would the impact, what sorts of cuts are you facing? I know you've already you've described the impact on the economies, but what sort of cuts would you be facing if you don't get some federal assistance? And Betsy, again, if you want to lead us off with that.
Sure. In the first CARES Act, we got $156 million, and that money is restricted specifically for COVID-19 recovery and response. It can't be used for offsetting revenue or anything. What we're facing most is we're not going to cut police and fire, public safety, our code. We're in good shape. We have more than 300 positions that were unfilled, and we've put a hiring freeze on those. We have furloughed 80 people from our public events fund because there are no conventions, no special events where we need them. I think overall you're looking at 70 to 100 million this year, and then it escalates 21 million or more in 21 and 16 million. I think the federal funds, I think this new HEROES Act, what the House passed appears to me, and when I talk to our Washington delegation, and like Eric, we talk to them probably daily. Sometimes they're tired of hearing from us, but they've got to understand those on the front line. This HEROES Act appears to be a placeholder from the House. The Senate will take it up. What I'd love to see is them put a little more flexibility in where cities and counties can spend this, some infrastructure funding, because we can create more jobs and replace jobs that are being lost with this as we go back in with new infrastructure projects, continue to help us grow the economy. And we've got so many small businesses. It's estimated 20 to 25% of our small businesses need additional loan. The PPP funds weren't near enough to help them. We can't afford to lose all those entrepreneurs and startup businesses, and we need to be able to augment some of that funding for them. And I think the HEROES Act is going to be a good start. I do expect it'll be scaled back significantly And we have to continue to have the input that mayors are on the front line. Eric mentioned county judges. County judges here in Texas run the actual public health, although they didn't declare it at first, and the mayors came together and did declare them in the big cities, and the county judges followed. But we're working closely with our county judges on what that might look like on funding. And in Texas, the strange thing was cities of over 500,000 got direct funding from the federal government, and the rest of it for small cities went to the governor, and the governor hasn't doled it out. So you've got cities that are sizable with major issues that haven't received any federal funds, and we're hoping this next HEROES Act or the next iteration of whatever it is will help with that for smaller cities too.
Yeah, that's a great point. Yeah, a lot of cities were left behind. I was part of that negotiation the night of the CARE Act, and it was only going to go through states. So I was glad that we got cities in there. For Mayor Price and myself, I didn't cut it off at 500,000, but I think negotiations had to someplace. But if you're 498,000, you got zero. You got bump kiss. So it is certainly a help for us because we are. I'll give you an example. We're burning through about $3 million a day. 75% that can be reimbursed, but $3 million a day just for testing in the city of Los Angeles, when our county or state or federal government should be paying for that, or our insurance companies, quite frankly. And that's where we need to get it towards in the medium term. But we will need direct assistance. I mean, $3.1 trillion is spent by state and local governments in the United States. About 1.7 of that is local government. Not all 1.7 trillion is going to go away, but think about this like the PPP, which I agree with Mayor Price. We've got to redesign for the small businesses who are not as well banked, how they can stand back up, because it's a real threat to our local economies. So I'll return to that in a second. But they didn't say, hey, we're just going to give you some money for your expenses during COVID-19. They said, here's working capital to restore what you do. They need to have that same business model for a local government as we did with businesses, because we're huge employers too. We're doing 10% furloughs across the board to all of our non-critical city employees. That's a big hit on city services. And if it got worse, and it could get worse, we're not going to see tourism back anytime soon, or hotels full anytime soon, sports events with stadiums full of people anytime soon. But we might have to look at layoffs. And I know a lot of my colleagues, like in Ohio, where they depend almost fully on income taxes, they're looking at like 70% cuts. So even if they can do it in a nuanced way that helps those who are in greatest need, I'd certainly stand up and say, here's my need. It might not be as much as others, although it's a lot. Maybe Betsy has even less than me, but another place has a lot. And, you know, when they did this first act, they had to do it quickly. But I heard about a county in Oklahoma that their full budget is $120 million because their population, they got $40 million. They're not only whole, they're swimming in money and not sure what to do with it, while other places are laying people off. So we have to be very careful. And on the business side, look, I think there's a real threat to kind of the small town capitalist system that we have right now. I really do. What will happen is, you know, if places go bankrupt, they're not going to disappear if they're big. You know, Wall Street and capital will flow in and stand up the big corporations. But in this next month or two, American entrepreneurialism will either survive or be significantly cut. And you know, when you look at struggling neighborhoods or poor cities in particular, often women-owned businesses or businesses that immigrants have opened up, in informal economy, these places are not going to come back. And so one of the things we need to really say is this isn't just about saving big corporations, as important as they are as employers. It's really about getting business assistance to leaders like Mayor Price and myself, because we know where those small businesses are. I don't think Washington can find them even if you gave them 3 months. They can't design the system. And it's tough because they don't trust us with their money. So they're like, oh, local government will waste it. But if you put some restrictions on it and say, you go find your local businesses and give them that $10,000 to buy the PPE and to hire back the employees and clean up the shop, they might stand back up. But if we don't, these places are going to be shuttered for a long time. And this is going to be not a momentary depression, but a longer term one.
It's just a tough.
Go ahead, please.
We're 2 weeks and you're just reopening, and we're 2 weeks into restaurants being reopened. We're actually 3 weeks into reopening already, but we're open at 25% first for restaurants, now 50% for restaurants and small businesses. They can't make money. They can't survive with that. They can't bring their full staff back, pay their utilities, pay their rent. It's a real tough spot with social distancing of 6 feet. Most of them can't even get to 50% of the restaurant with those requirements. And that's a message that Washington needs to hear specifically.
So I want to stick with the theme of Washington and transition it to looking at the universe of mayors too. We have seen so much fractured partisan division in Washington, and yet among the community of mayors, by and large, if I were to generalize, I would say there is a lot of incredible bipartisan cooperation. The U.S. Conference of Mayors, of which you are both members, which AJC is proud to have a partnership with the U.S. Conference, and it's through that partnership that we now send delegations of mayors to Israel every year through AJC Project Interchange. Again, you've both been to Israel with us, which we're really proud of that. You come from different political parties, and there's plenty that you are agreeing on here. And I think when we listen,
what party are you a member of? I don't know what party Mayor Price is.
Okay, so yeah,
Todd knows what party is, right?
Exactly.
I'm interested, though, in that collaboration among mayors, and if you could speak about the nature of bipartisanship among mayors and why it is not as fractured as it seems in Washington.
Eric,
and Eric, why don't you?
Well, I'll jump in. Okay, yeah, sure. It wasn't a joke. I mean, I'll tell you a story. When I hosted, we're at the U.S. Conference of Mayors in Boston, a dinner just for mayors of big cities, and with no agenda and no speeches. So there were like 30 of us. And next to me on my left was Mayor of Cincinnati, and next to him was the Mayor of Miami, and they talked all night. They talked about the environment, they talked about immigration, they talked about fiscal responsibility. And at the end of the night, the Mayor of Miami said, "Oh, so you're a Republican?" to the Mayor of Cincinnati. And he said, "No, actually, I'm a Democrat like you." And the Mayor of Miami said, "No, actually, I'm a Republican." And it was one of those moments where they talked the whole night. They didn't, like most Americans, ask first, which cable show do you watch and what party are you? They agreed on immigration and being welcoming to people. The mayor of Miami, Francis Suarez, is himself the child of Cuban immigrants. He's very pro-environment because he's right there on the front line of what climate change looks like. He's very pro, immigrants and immigration reform. And John Cranley is a great kind of pro-business Democrat who's helped stand up the revitalization of neighborhoods and infrastructure. So mayors really do model this, not because it's something that we score political points for, but when I look at my constituents, I don't ask when they call, "Are you Republican?" Because I'm not going to fix your street if you are. Whereas in Washington, I think there's a filter for the front desk when a call comes in. Is this a Republican or Democratic call? And part of that is because we've been trained to only call Congress to either shout at them in a partisan way or to praise them in a partisan way. And I was pleased. It's, a very difficult thing to fix in Washington. It's so embedded, and the culture of it is so rewarding to those who become the most partisan. And I don't know how we unwind that. But I was pleased to see Republicans voting for things like, here's cash payments in the midst of a crisis. And for Democrats to be talking about some of the ways that we have to help small businesses out in this country. So I think, more and more, we need to find those models, even on an election year like this, where it's tough. If we're going to get through this together as Americans, we have to stand up things that cut through this. In moments of crisis, whether it was the Great Depression, World War II, the Cold War, we found more to agree on than to disagree on. But I'll tell you this too, I've had good interactions with many aspects with the administration during this crisis. I can also criticize them for all sorts of things I think they mishandled and continue to. But at the staff level, I know some really good people, and they've helped get things like the CARES Act support that Mayor Price and I got. But on Friday, I was attacked by the White House and by the Justice Department. The White House said, we're worried that there's too many cases and they're opening too fast. And the Justice Department Civil Rights Division said I was violating people's civil rights because on a news program, I said we'll probably never be back to normal completely until there's a cure, which was just a truism. There's going to be certain things that we can't do. And they said, you're infringing on people's civil rights. So I called a friend at the White House and I said, you can't attack me for being too fast and too slow. And I didn't see you attacking anybody who's Republican. So we all could find criticism in the way everything's being handled. This is a gray moment. I'm very proud, though, that here in Los Angeles, we serve everybody. And I'm sure Mayor Price does the same thing. She doesn't care if you're a Democrat coming to City Hall. In fact, we see people before we see party.
Yeah, I think that's the beauty of mayors. On a day-to-day basis, you're police response. 911 doesn't care whether you're red or blue or whether you watch Fox or CNN. You want a police officer to show up. If your house is burning, you want a firefighter to come. Our job is to deliver those services. And city government is not partisan. Clearly, everybody knows mayors lean a little right or lean a little left, but the best jobs in America in government are always, the decisions are always made in the middle. And you have to get to a compromise and you have to be able to work because your citizens expect that. They're not going to take no for an answer just because you're on the right or on the left. And public health issues, while I believe city government should never be partisan, and I do think, like Eric, that's one of the biggest failings in Washington the last few years. The last 15 years, they've gotten more and more partisan, and it makes it really difficult for everybody to work with them and to get their answers. But I think public health issues, and we've said from the get-go that this is not a partisan issue. It must not be. Early on in this, I mentioned the big city mayors, the mayors in Texas, the top 8 or 9 of us talk. We were talking every day, and now we talk once or twice a week. And there's 9 of us, and of that group, there's 7 who are definite Democrats and 2 who are probably Republicans, but we all issued pretty much the same stay-at-home orders, pretty much had the response, had the issues over not enough testing, not enough PPE, how do we attack this, and how do we serve our citizens? And I think that's why mayors lead in this country more than anyone else, because they are on the front lines and you can't wait on a partisan decision to make things work. You know, I co-chair the smaller mayors in this area too, and I've worked on numerous other things. It doesn't matter whether you're 50,000 people or several million, it doesn't make much difference. You still have to deliver service. Think about the health of your citizens. You've got to get that delivered to them, and you've got to be able to talk to your friends in Washington and try to coerce them to get this done. I was pleased that the first CARES Act was probably the most nonpartisan vote that both the House and the Senate had had. It looks like this next one, the HEROES Act, is not going to be as nonpartisan. But I thought that was a little bit step in the right direction, and I would love to see some of that hold in Washington.
Likewise. So one of the reasons why we bring mayors to Israel is to show off innovation. And we know that mayors are great innovators. And you're always looking for good ideas and looking for ways to deliver the services and to meet the needs of your constituents in innovative, creative ways. And nothing breeds creativity like a crisis. So I'm interested to know what are some of the innovations that you've employed in the midst of this crisis that have really helped your communities. And Mayor Price, let's start with you.
You know, we've been able to do several very innovative things. And I do think the trip to Israel, because Israel's the most innovative nation around. And one of the things that we used is we made a contact when we were there with Zen City, which is an Israeli company that does software analysis and social media analysis. And early on in this pandemic, we called our friends at Zen City who we've been working with, and they set up, they ran all the social media to see what the response was, Twitter, Facebook, everything. It gave us a much better look at how our citizens were feeling, what they were saying. When you can analyze that, that was a big, big help for us. We also set up the first week a child care network for resources for first responders and hospital employees, doctors, nurses, everyone, because childcare was closed down. We were able to set up a whole website network and help provide childcare for first responders. The model was so successful, it was set up in about 9 days that the state adopted it. The state of Oklahoma and Louisiana are all using the same software now. We've been really lucky in that. We also early on petitioned for one of the Battelle decontamination stations. We can do up to 80,000 masks now in that, and we're doing it for 17 counties around us here. Well, one of the things that I'm particularly proud of is our firefighters came to us and said, let us help with the testing. And they have pretty much run public testing for us. And they came up with a background as we've had an outbreak, I know Eric has too, with nursing homes. And they said, we will volunteer to do the testing of every nursing home employee and every nursing home patient And so they've been doing 300 to 400 a day. And it's been so successful that the governor has now adopted it for other cities to use and mandated full nursing home care. You just have to get with your employees, get with your businesses, and think through things because they've got great ideas. I don't claim pride of ownership in any of those. I was just able to help get them implemented.
Great. And Mayor Garcetti, you mentioned Dodger Stadium. That's a big one, but I'm sure there are others.
No, you have to be so creative in the midst of this because the suffering's so great. But you know, we use Dodger Stadium and firefighters to stand up testing centers. It's Los Angeles, so Sean Penn, the actor, who founded a group called CORE, which had worked in Haiti and other places, suddenly said, "How can we help here?" And so we've got hundreds of volunteers that are staffing these 38, testing centers across Los Angeles County. We've been very proud to also stand up. One of the folks that were left behind, or groups of folks that were left behind, were immigrants in this. The legislation that moved forward in the CARES Act, if you're the U.S. citizen child of an undocumented immigrant, you don't get the $500 every other American child gets. If you're married to somebody who's an undocumented immigrant and you pay taxes and you're a U.S. citizen, you don't get the assistance. It's kind of crazy how many, I think probably in Texas with a high population of folks that are immigrants here in California, just in practical terms, people aren't leaving in a pandemic, they're gonna suffer. It's just practical assistance, let alone that they pay taxes and that we've not done anything on immigration reform in so many years, even though led by George W. Bush at the time, 20 years ago, we had a consensus on this. So we've raised $53 million privately, because you can't use federal money for this, to hand out debit cards of either $700, $1,100, or $1,500 so it's kind of their stimulus payment essentially to anybody. It's not just for undocumented immigrants, but it's for anybody, including, without prejudice, without discrimination, people who are here working hard, wanting to become citizens, because they feed a lot of people, they have bills, they're critical parts of the economy, and they won't come back. So we've been very proud that that'll probably affect 150,000 people in families as a way to give cash assistance in the midst of this disaster.
Wow, that's powerful. Go ahead.
It's been amazing to watch the foundations and the large corporations come together with us on private and public partnerships to help, just like Eric mentioned. I think we're seeing that, the generosity of Americans all over the nation, because we've certainly seen it here in Fort Worth too.
Yes, again, these moments of crisis do bring out, there are silver linings that we can point to. At this point, I want to turn it back over to Daniel to take some questions. I know we have a lot of questions from our audience, and I'm hoping that somewhere in the questions we can weave in a little bit about responding to some of the negative responses that we see, the bigotry that we've seen against the Asian American and particularly the Chinese American community. We've seen a lot of conspiracy theories about the Jewish community being somehow responsible for the creation and spread of COVID-19. So I am going to turn it over to Daniel, but I'm planting that in there as well so that hopefully we can address that in the Q&A.
Thank you, Melanie. We've been receiving a number of questions to you, Mayor Garcetti, including from AJC leader Ed Blank, who's asking about the homeless population in Los Angeles and how COVID-19 is complicating efforts to address this problem. Can you speak a bit about what you're doing to address the homeless issue? And to you, Mayor Price, Fort Worth has had a significant outbreak in a federal prison where undoubtedly a lot of the employees are residents of Fort Worth. How do you prevent further community spread? So for you first, Mayor Garcetti.
Yeah, thank you, Ed. I called 2 years ago in Los Angeles for a FEMA-like response to homelessness, those quote unquote successful cities where you can't build housing fast enough, and decades of not really local policies, but I would say, no mental health care system in this country. Everybody has, I think, addiction issues in their cities, but those where rents are high, they conspire to put people on the streets. I begged FEMA before we had El Nino to be able to house people experiencing homelessness before the disaster hit. Luckily, El Nino wasn't the disaster everybody thought, but they said, no, FEMA doesn't do that ahead of time. It's only after they're flooded out that we can give you money. I said, well, that seems to be kind of backwards. And I've been working with the White House and Ben Carson in the most unlikely of buddy movies. We've become close friends. And working to get some federal resources, I pushed my state, and I passed the 2 largest measures in US history at the local level for building housing for folks who are homeless and for services. That said, this crisis actually has accelerated our solutions. We were bragging that we were building more shelters than anywhere in the country, 18 of them that would be about 2,000 plus beds in an 18-month period. We housed 3,000 people in the last 6 weeks. So we stood up every rec center, hotels and motel rooms, and FEMA, thank God, said that for the first time in their history, they will give you money for a disaster before the disaster hits people. So in other words, people experiencing homelessness before they contract COVID-19, we're able to house now. And we've actually seen lower numbers generally among our people experiencing homelessness than those of us that are housed. We took this disease to the streets, not vice versa. And we've, like I said, put about 3,000 people and climbing into housing of some sort. It's the most complicated issue in the world that I've ever dealt with, for sure. And every country that doesn't have homelessness just has a right to housing. Think about, we do that with food, we do that with medical care, so Medicaid and food stamps. If you qualify, you get it. It's universal. But if you qualify for housing, like a Section 8 voucher, there's a 1 in 8 chance in my city, 1 in 4 chance nationally that you get it. So we see a lot of people out on the streets. That said, I'm working very hard to make sure at the end of this crisis, and pushing the feds very hard, don't let these people just return to the streets. We have a once in a lifetime opportunity to transition them from these shelters as we open up our rec centers again, and from these hotels and motels to maybe even purchase some of them, and to keep them housed and to move them forward. But we can't do this without the commitment nationally and through our states and counties to have a mental health care system, because housing is one thing, and then you got to work on the reasons why they're on the streets. And that's often related to either addiction or trauma or the combination of both.
You've had a strong response, Eric, on homelessness. We've dealt some, and I was asked to talk about the prison. I will. With our homelessness, population is much smaller than yours, but we had to separate them out of our shelters into our convention center. Also, in our private partners, we've stood up with the Apartment Owners Association, Rapid Rehousing, and with MHMR, mental health issues. Dr. Carson has been very good about helping too. So I think most of the cities have had very good response on homelessness. The federal prison that's here is a medical facility for us. We had a major outbreak in the prison. We struggled a bit with their union for whatever reason, didn't want everybody tested. We actually had to sit down, the county judge and I, with several of them and say, you have to do this, your workers are back in our community. We had to pretty much go in and close the prison. They set up tents outside. We provided temporary housing for employees who hadn't gotten their test back or who needed to be screened and didn't want them going home to their families. Mostly the prisons were just pretty much shut down, including their staff. They're opening back up a little bit now. We've got a better handle on it. But the workers oftentimes go between facilities. We have a couple of federal facilities here, so we simply couldn't allow that for the spread in the prison. We've been able to get a pretty good handle on what's happening there. Unfortunately, those are tight quarters. Since this is a medical prison, federal prison, most of our patients there have other comorbidity issues. We've had a fairly significant death rate there, and it's a very susceptible, vulnerable population. Right now, I'm pleased with what the response has been and where it's going. It looks like we've capped it, and their numbers are going back down.
Thank you. Picking up on what Melanie had to say with regard to anti-Asian and specifically anti-Chinese bias to anti-Jewish conspiracy theories and Nazi imagery, what is your role, or what are your roles as mayors in both reacting to this kind of bigotry and to protecting minority communities that might be targeted? Mayor Garcetti?
Yeah, look, this virus loves division, and certainly people who want to divide the American people love how the pandemic can become for everybody the vehicle of their prejudice, of their conspiracies, and much more. When we saw, for instance, the analysis just done, I think by Carnegie Mellon, that the strongest accounts calling for the most reckless and quick opening of the country, over 50% of them were bots. We see that kind of racial division where people are saying this is a conspiracy against African Americans, this is a conspiracy of Chinese. Like, a lot of this is not being done by people who are even the usual suspects, and maybe who don't even believe in these things. They just know that they are buttons to press to divide America. And certainly, though, the impact they have is they made much more permissible the kind of conspiracies and the prejudice that we see. So every night when I do my nightly address, you know, I'm always talking about this. And early on, certainly even before we closed down the city, we were seeing people that refused to go to Chinese restaurants and Asian-owned businesses. And we just said, hate has no place here. I went out there myself to show and to demonstrate that, you know, there's no connection between a Chinese restaurant and China, certainly not Wuhan, China. We haven't seen as much I've read some things about the anti-Semitism. There's, you know, we Jews will always be thrown into any conspiracy. It's just like, that's the default. So I'm sure we're responsible for what's, you know, terrible. Maybe we figured this out in the lab and sent it to China. There are those who hate us and will always do that. But I think also it's important not to give too much oxygen to them. If it hasn't reached the level that people are hearing about it, it's a balance between condemning when you do hear it and people are now on the street kind of saying it, versus, okay, I found something on a comment page, and when you hold a press conference, suddenly you excite people who are anti-Semites that we're all talking about it, and they landed a hit. So I always try to balance those things, so I haven't given a lot of oxygen to the tropes of anti-Semitic involvement, but certainly with the Asian and Pacific Islander community, we've been very, very aggressive just to let people know that has no place. And we've seen it really fall off here in Los Angeles. I think that messaging helps and it matters.
Yeah, I think there's no place for bigotry or hatred here, and certainly not during the middle of it. There never should be, and certainly not during the middle of a pandemic. A whole lot of it, ours has not been as bad as some cities, but like Eric, we've tried not to give it a lot of oxygen. You don't want to give it a lot of oxygen and feed that fire for sure. What we've seen is it's simply that the fear of the unknown. People, when they have a lot of time at home, and a lot of people have had a lot of time at home, they don't know anything early on. They knew nothing about this virus and how it was going to impact them. What was it going to do to my family, my children, my loved ones, my job, my ability to earn a living? And if you can communicate with them, help get the message out, the open doors on the communication seems to help alleviate some of the fears. Bigotry is with us, and we have to keep it squashed as much as we can at any time. And mayors are very good at that. But in this particular case, a whole lot of it has been driven, as Eric said, by the bots and the trolls who just have too much time on their hands and to troll. But I think getting ahead of it with the communication, we did for 3 weeks, every afternoon, like Eric does an address, we did a Facebook Live, and we tried to communicate the basic, help people get past their fears. And it does seem to shut some of that down. Overall, I think most people have a pretty good trust in their mayor. And if you're there front and center where they can see you, answering their questions, taking their concerns, they feel a whole lot better about it.
Thank you. Our next question comes from Bethany in New York, who asks, there's been a lot of confusion in New York specifically about the authority of the mayor versus the authority of the governor. Can you describe this process in your states and how you're working to balance the local versus state decisions, especially on planning for reopening?
Well, as you see, it doesn't always go, well, I don't know. You want to answer, Mayor Price? Go ahead. No, I think, look, you've got sometimes where there's a split and it becomes a partisan thing, and then there's a split where it becomes a personality thing. Mayor Price can talk about her relationship with her governor, and I know Texas is interesting because the lieutenant governor is as important as the governor, but arguably. But in California, you know, I've had a very close relationship with Governor Newsom. It is very, very confusing. Forget the personalities, because I think New York is unique, and that's about two personalities that have just clashed and seem to enjoy clashing or whatever. And I'm friends with both of them, so I don't understand it. But they have never been able to, I think, find the level of peace that I think their constituents would like them to see. That said, it's confusing for folks who don't know what is the CDC saying, and there's been very little federal guidance, I think, for worse, not for better, unfortunately. But then at the state level, they're like, what is the state in charge of? What's a county in charge of? And what are you in charge of? I'll give you an example. Our county health director for the county of Los Angeles, 10 million people, was asked by one of our county supervisors how long a health order would be in effect. She said, well, at least a few more months. That got reported by newspapers, which are dying right now, with kind of clickbait that we were going to be locked down for 3 more months. Suddenly CNN picked that up within minutes. I was going on CNN anyways, and they're like, Mayor, we heard you just announced 3 more months of lockdown. I hadn't said it. It wasn't what she said. And I spent the next few days. And then by the time it migrated over to Fox and became Hannity's and Tucker Carlson's main, with me as the victim, main speech that the mayor of LA was shutting down America, you realize that it is not only manipulated by folks who want to use this as a way to like blame us for this crisis instead of solve it together, but that it is confusing for people to know where authority really lies. And mayors can often shut things down, but we rely on county or state authorities to open them up. And then the states don't always have the authority. So you saw Governor Cuomo and Mayor de Blasio getting a fight about who controls the schools and when they open. These rules aren't always clear. So the one thing that I'd say productive, I hope, comes out of this for America, it wouldn't have mattered. There's a ton of missteps this administration made, and I do think it cost lives. But if Hillary Clinton had been president, we still would have been an unprepared country for a pandemic. We need to take mutual responsibility that this country had never been through a public health emergency the way that we've seen in the Middle East or in East Asia. This better be a wake-up call for the second wave, if there is going to be one, that most likely can be here in the United States, or the next time this happens, because this will be an ongoing threat for the rest of our lives. So let's stop the blame game. Let's figure out a way with clear lines of communication. I'm a big federalist. I love that we can do things differently in California than other states, but the federal government should exist for certain things, to protect our nation from foreign threats or from pandemics. And I do believe that that is something that needs to be clear. We need to build up the stockpiles. We need to have quicker money, resources, and direction that goes out to the local level, and clear authority for local people who are on the ground to be able to enact and save lives quicker than we saw in this country.
I think everybody's learned major lessons here. I think stockpiling, all of those, there's enough blame pointing going on everywhere. There's always confusion about who's really in charge. The average citizen, 86% of Americans live in a city, and most of them see their mayor. They can, when you poll, they can identify their governor, they can identify their mayor. And generally, those are the two most identifiable. They just assume the mayors are in charge of everything. So when you get into a crisis like this, it gets a little more difficult, because in Texas, early on, our governor said, I'm going to turn this over to the counties and the cities and let y'all decide. He didn't issue a stay-at-home order. So we all got together and issued ours and began to handle it. As the reopening goes, he's now done vice versa. He said nobody can supersede his orders for the reopening, that he's going to control the reopening. We've got a real good working relationship with the governor. We have not been at odds with it, but it's been very interesting to watch the flip-flop on who's got the power and here and how this goes. And it's not good for your citizens. I think we owe them, my main thing is you got to communicate with them. And when asked, I try not to necessarily say the governor's in charge of that or I'm in charge of it. And in Texas, like you, Eric, you've got a county judge layered in too, with county authority. That's even more confusing because they're our actual public health administrators. Yep. So it doesn't matter to Susie on the street or Joe who's in charge. They just really want an answer. We try to get those answers and deliver those services as best we can. And behind the scenes, we're pedaling like crazy, calm and collected on top, like the proverbial duck, pedaling fast underwater, working with our friends in Austin at the state capitol, and certainly with our friends in Washington. But it is a bit of a confusing situation, but it splits the power up. And in America, we've never liked having power in any one person's hands. So it's a good, bad situation.
Well, I'm going to jump back in and say that to your point, Mayor Price, about trust, there was a recent Harris poll in which he asked who they trusted most regarding information about the spread of COVID-19, and the mayors came out far and away on top, with 72% of respondents saying they trusted their mayor. So I think we have so much that we can learn about leadership, about resilience, about transparent communication, and about just good, responsible governance. So we're so grateful to both of you for your time today and for giving us such a robust discussion. I know we could continue and go on, but our time is coming to a close. So I want to hand it back over to Daniel for concluding remarks. And again, just add my thanks and say how happy I am to see you both looking so well.
Thank you.
You too, Melanie.
Thank you, Melanie, for that fascinating conversation. And thank you, Mayor Price and Mayor Garcetti, for taking time out of your incredibly busy schedules to be with us today. I also want to thank our audience for joining us and showing your commitment to the topics discussed here today. If you enjoyed today's program, make sure to also check out AJC's weekly podcast, People of the Pod. We examine current events, the people driving them, and what it all means for the Jewish people in Israel. Visit ajc.org/peopleofthepod. In these unique times, while so many of us are separated from our family and friends, AJC is still bringing us together on the issues that matter. Please consider making a donation to AJC so we can offer you more programs like this one. Visit ajc.org/donate. Our next Advocacy Anywhere program will feature a conversation with Dr. Richard Haas, President of the Council on Foreign Relations. Dr. Haas is a veteran diplomat, a prominent voice on American foreign policy, an established leader on nonprofit institutions, and a steadfast friend of AJC. Dr. Haas will join in conversation with AJC CEO David Harris on the state of international relations in the COVID-19 era, as well as Haas's new book, The World, A Brief Introduction, a primer written for experts and non-experts alike. This program will take place tomorrow, Thursday, May 28th at 12:30 p.m. Eastern Time. I hope you will join us. Please stay safe and healthy. Thank you again. Goodbye.
Thank you.
Thanks, guys.
Thank
Take
you.
care. See you, Melanie. Great to be with you, Betsy.
Bye.
Hey,
Bye.
like